Welcome to Inspiring Each Other. I'm Dr. Phil Worth, and tonight I'm here with Annie and Bernie. We're going to talk a little bit about cardiovascular health. Bernie had an event some years ago, and thank you guys so much for agreeing to come on the podcast and share your story.
Happy to do so, Phil.
Bernie, start at the beginning. Tell me through the symptoms and how does your heart stuff start?
Well, I guess it really started with my general practitioner and the tests that he had run on me, just a matter of practice. And he put me on both blood pressure and cholesterol medication. As time went on, I was actually going out and running, a couple of miles a day. I was by far not a marathon runner or anything, but I'd go out and run a couple of miles a day, 4 or 5 days a week. And, as I was running, I would feel a little bit of jaw pain, but nothing real significant. And I, kind of thought, well, maybe it's just, the cold weather that I'm running in, or, some other exterior, issue that might be manifesting itself in that jaw pain. So at an annual meeting with my general practitioner, and in a discussion that we were having, he said to me, "Is there anything going on with you that I should know about?" He said, "You're doing pretty well. You're doing good on the meds and that kind of thing. But is there anything that I should know about?" I said, "No, I'm feeling pretty good. I'm feeling pretty healthy. The only thing is every once in a while I get this jaw pain." He said, "Jaw pain? Well, that's interesting. Tell me a little bit more about it." And I said, it's pretty consistent whenever I go out and run, but it's not, it's not terribly painful, but it's there." He said, "Okay." Given the fact that I had heart issues in my family, one of my older brothers, there were 6 of us in the family, 1 girl, 5 boys. But one of my brothers had a pretty significant event. I think he was 61 maybe when he had actually it was mid 40s. He had a pretty significant heart attack. And so, my doctor had said, since you've got family history and since we've been treating you for, high blood pressure and cholesterol, he said, maybe we should do a stress test. And I said, okay, fine. So we got that scheduled, and the readings came back inconclusive. And so, time went on. I mean, we didn't do anything really about that, So I'd say it was probably another few months anyways. I had gone back in for another appointment with this primary care physician. And he said, "Are you still experiencing the jaw pain?" I said, "Yeah." Again, not anything awful, but it's there. And he said, "All right, well, I think we need to do another stress test on you and see, how that one comes back." So we did the second stress test, and again, it came back inconclusive. He said, "There's something there, but we're just not quite sure exactly what it is." So I think the next step in the process would be to do a cardiac catheterization up at the hospital in Rochester. So I said, okay, if that's what you're recommending, that's fine. Happy to do so. So they went ahead and scheduled the cardiac catheterization, and the the doctor had said to me, before this procedure, he said these things usually take 20 or 25 minutes, and he said you'll have a screen there and you can watch it. Kind of interesting if you'd like. I said sure, yeah, that'd be fine. So we got it scheduled, and I think it was probably another couple of weeks, between the time that we did the cardiac catheterization, or between the time that we did the stress test, then came back in to do the cardiac catheterization. A few weeks had gone by. So went in for the cardiac catheterization, and it was about 10 minutes into the procedure, and I heard him say to one of the nurses, okay, that's enough. I don't need to see anymore. And I thought, that's either really good or really bad. And sure enough, he came back and said, look, you've got 4 arteries that are significantly blocked, and we need to go in and do some open heart surgery on you. And I was completely shocked. I didn't have any real thought that that would be the result of this test.
You're how old at this time, Bern?
50.
Annie, what do you remember about those early times? As men, we tend to minimize our symptoms as we're going through things. As the concerned wife and young mom, you had 3 young kids at that time, right? What do you remember about the first couple of months of Bernie's story with this jaw pain?
I remember the first time he came home from a run and said, it's odd, my jaw is bothering me, my jaw, it's uncomfortable. And I said, well, is it painful? No, it's uncomfortable. But you also, I remember, he was working, and you were tired a lot in the afternoons. I remember you'd say, gosh, I'm so tired. Why am I so tired? And of course, we, 3 young kids, working full time, a stressful job, busy lives, right? And then it took us a little bit to push the doctor too to do some of these tests, and because I was like, the signs are there: the family history, the high cholesterol, the high blood pressure, now the jaw pain. Of course, I'm doing my Google searches and all, but so, and then when they called, it was Memorial Day weekend, and he was planting arborvitae trees, I remember, and the hospital called and said, don't do anything stressful this weekend. So.
And then we go up for this cath.
And then we go up for the cath, and he goes in, and we're pretty optimistic people. We try to stay positive about things, and I remember, on the way, this will be good. We'll be all right. We'll be fine. And if not, whatever comes our way, we will deal with it. And I remember my brother, who lives in Rochester, met us up there, and Bern went in, and my brother and I went and got breakfast and brought it back to a room, and we thought, okay, well, we'll just have a little breakfast and wait in here and go home, And they came in and told us that Bern was going to have a quadruple bypass, and needless to say, we never ate our breakfast. We left it there, and we're there for what, almost 10 days, I think.
From that moment, do you walk in and you say, hey, honey, I love you, see you after surgery? How quick, Bern, after the cath, did they take you in for the next surgery?
So it was probably, I'm going to say it was probably 4 days.
3 days, because you wanted to wait for specific doctor who they said was the best there. He could have had it the next day, but they said, or you could wait Dr. Kirschner had other patients and other surgeries, but he's available Thursday. And so they kept him there.
In those handful of days, did you feel anything, or you're just laying in bed relaxed and comfortable?
I was just relaxed and comfortable, scratching my head saying, how did I get here? How did I get here? But yeah, it was a lot of surprises, one right after another.
I think, life sometimes throws these surprises at us, whatever they're going to be. What were your emotions as you're going through that? Are you scared? Are you anxious? How old were the kids? What's running through your mind about their future?
Phil, you hit the nail right on the head. So coming back out of the cardiac catheterization, immediately I was scared. Our kids were, 1, 3, and 5 or something in that area. And, I'm thinking, geez, I've got this wonderful family, a great wife, beautiful kids. God forbid something happens on that operating table. What's going to happen to them? Are they going to be okay?
Terrifying, right?
Yeah.
I remember walking in and I remember you had tears coming down your face. It was an emotional day.
Well, and Annie, I know you lost your dad very young. And now here your husband is at 50 with 3 young kids.
Right.
What goes through your mind at that moment? Same stuff?
The same things like Bern said. Yeah. Yeah.
So you meet Dr. Kirschner, and he can be a very humble man in my experience. How does that explanation of the surgery and what he's going to do, and how does he explain that to you?
Well, the thing that I remember the most about Dr. Kirschner, and it started actually as I'm on the gurney coming back from the cardiac catheterization, because they're putting me in a room. I'm not going home. And the nurse said to me, hey, if you have an option and you can get Dr. Kirschner, get him, because he's the best there is. I said, okay, thanks. We get in the room, they do the things that they need to do to admit me. And I'm laying in bed, and in walks this gentleman, and he had a PA with him at the time. And he introduced himself as Dr. Kirschner, the head of thoracic surgery, right? And he said to me, hey, I understand you need some significant work done. And I said, that's what they're telling me, doctor. And he said, well, we got a couple options. You can either have one of my guys on my team, who are all excellent surgeons, do the surgery on Monday or Tuesday of this week, or you can wait until Wednesday, and that's the first time that I've got an opening on my schedule. And I said, well, Dr. Kirschner, I was just told that you're the best. And he said, whoever told you that was correct. I am the best. And I said, and I'm just going to wait until Wednesday and have you do it. He said, smart decision.
So what about the moments before? Now Wednesday's here and off we go. What's going through your head as you run down that road?
It's still a lot of emotional stuff relative to my family, and, just the kind of thoughts of, what are the chances something can go wrong? I mean, I thought at the time, well, look, you've lessened the chances by getting the best surgeon here, so you're going to be okay. But there were some interesting things the day of the surgery, right? The first thing that I still remember is there was a nurse there, and she said to me, you and I are going to become really close friends here. And I said, why is that? Because she was chuckling.
Yeah.
I said, why is that? She said, because I'm going to shave you from head to toe.
Oh, no.
So that was the lighthearted kind of beginning to the process of the surgery taking place that day. The other part of that day of that surgery that I remember is coming out of the anesthesia. And that was terrifying because it felt like I was choking and I couldn't do anything about it. And they told me after, I mean, they had given me some, I don't know what the drugs were that they may have given me, but it settled me down because I was really anxious. I felt like I said, I felt like I was being choked. But evidently that's kind of not atypical coming out of a heavy anesthesia.
Essentially, we cut your chest open with a saw, right? We stop your heart, we hook you up to a machine, and then we fix it.
Yeah.
When I say we, I'm not Dr. Kirshner, right? But the medical team does all that stuff. Is your approach of that day, Annie, how do you explain things to the kids? What do you say to the little guys?
Well, I was actually thankful that we had a little time before the surgery. You know, I could go home and get things settled at home, and I knew he was in a good spot. You know, I knew that. I mean, he's there. He's at the hospital. If anything happened, you know, he's in a good spot. So I was able to go home because the kids were actually going to school in Geneva at St. Francis St. Stephen. So, you know, I was going from Santa Claus to Geneva in the morning, bringing them, and then back in the afternoon to pick them up, and then back again if they had play practice or a game or something. So it's a lot back and forth.
Yeah.
It's a lot. And so I had to just make sure that they were settled, you know, that their life continued to go on, that mom and dad were going to be okay. And
So Hannah's 5. Do you
No,
explain
no,
anything to her?
Hannah was in 5th grade. So Hannah
Oh,
was,
5th grade.
and Lewis, no, I got that wrong. Sorry. Jake's in preschool because I remember first thing you went to was his preschool graduation. And then Lewis, they're 2 years apart. So Lewis was in 1st grade, Hannah's in 3rd grade.
And how do you explain things to those young guys? Or you don't. You just say, Dad's got a thing and
Dad's-
he's going to be home in a couple of days.
Pretty much at that age, yeah. Yep. And, you know, packed up their bags for them because I knew that we were going to have a long haul ahead of us and brought them to my mom's. And, you know, so thankful for our family and friends and the support that we had, really.
Right.
I mean, my mom was a rock star. You know, she took the kids, they slept there, and, you know, we just tried to keep their lives rolling as normal as possible.
I think everybody that goes through whatever their bump is, whatever their mountain is that they have to tackle, everybody talks about their friends and family and the wonderful support. Bern, did you have friends, buddies? You know, us guys can have a hard time talking about things. Was there some of your guy friends that were close and helped you through it?
Yeah, definitely. There were several. I was lucky. I had a great support base, not only family but friends and coworkers. So at the time, I was working for AT&T up here in Rochester, and I had, you know, a dozen at least people that I was friends with out of that relationship. And you know, after the surgery, when I got home and was recovering, you know, every day it seemed like we would get a package of something, food or, you know,
Great.
yeah, the outpouring of support that we got from friends, family, and coworkers was just remarkable.
Awesome.
Talk about the physical recovery. We've cut your chest open with a saw and you're held together with some wires and we say, see you later. Come back and see me in a week, right? When those first steps at home, that first night at home, how does that part go?
It was rough. I mean,
It was Father's Day. He
Yeah,
came home
that's
on
right.
Father's Day.
Happy Father's
Very
Day.
yeah,
nice.
happy
Yeah.
Father's Day, and it was a happy Father's Day.
Mhm.
I was very happy to get out
We
of the
pulled up to
hospital.
the Little League field, remember?
Yeah, that's
We
right.
didn't get out of the car though.
Yeah.
The boys had a sorry, I didn't mean to.
No, go ahead.
No,
The
that's
boys had a
fine.
Little
The
League game?
boys had a Little League game, and he was missing them terribly, and so we pulled up, but he didn't get out of the car, of course, but he watched from the, yeah.
Yeah.
It was cool.
And a lot of people came over to the car and,
It was great. But
That's a nice homecoming.
yeah, it was. But it was, I remember, Phil, they weren't going to let me out of the hospital until I was able to um, operate this. It was a plastic, you blew into it and it
Mhm.
moved the bubble up and down or something. It was, I don't remember exactly what it was, but it was, I know, to begin with, I could feel the progress that I was making. But then as it got closer and closer to, the time that I was supposed to leave, I still hadn't gotten to the point that I needed to from a breathing perspective, so that was a little frustrating. But, a couple of days later, like Annie said, on Father's Day, they said, okay, you've, passed this hurdle here. So now you can go home, but you're going to have to do the same thing at home. And it was, it was uncomfortable, but it was something that we worked on daily. And,
the
then
the drainage balls were awful. The stitches in the leg. It was.
yeah,
Yeah, physically there's a lot, right? And if
There's a
you
lot.
if you think about it, we've cut your chest open with a saw, and what we're telling you is, I need you to take a big deep breath, expand your chest, and then blow all the air out. And that's not fun.
No,
And you got tubes coming out of every different place with all the drainage. Did you go home with a lot of the tubes still in before you went back? Or were some out or some were in?
I think some were out and some were in.
The drainage balls you had.
Yeah,
I remember.
How was the first night?
I all I remember is that I was in a recliner, that I couldn't really get up and go to the bed, or it was uncomfortable. So I was in a recliner and slept in the recliner for a couple of nights at least.
Yeah. Till we
Um,
found out where you would be comfortable. It was all new. We didn't know. We were in
Right.
uncharted territory,
And I had, air pockets form in my
Mhm.
back, which made it terribly uncomfortable. And yeah, so that part, the first night at home, I mean, it was great to be home with my wife and with my kids. And as long as the kids would not jump on me, I was really happy to be really happy to be there. But yeah, that was part of that was, the beginning of the process of recovery at home. And then I went to the cardiac rehab in Clifton. They had a program there. I don't know if it's still operating or not, but it was really, really well run, and the people were spectacular. Took really good care of me, and pushed me to make sure that I was meeting certain hurdles that they needed before they'd be able to let me go off on my own. But
It as you talk about all this physical stuff, there's also the emotional piece. When you're in the hospital, you're okay. There's the buzzers and the beepers and the nurses. Now you're home in your recliner. What's the emotional recovery as you're sitting in the recliner wondering, what if? I got to imagine some of that stuff runs through your brain.
yeah, you go through all the stages, but it's again, it's the support group that you've got around you that makes it a lot easier to take. And we were we were just so happy that I had made it out of the surgery and made it through the first part of the process, being in the hospital and in recovery, um, and now being home and moving the ball forward there. It was just,
And having the three little kids around, they're still running around and still needing their homework done and still having their, games and stuff. So that certainly,
it was fun watching them.
yeah. I guess if somebody was all alone, it would be really
Hard.
isolating. Yeah.
I know When my dad went through stuff, my mom would watch him breathe. She was so worried about losing her husband that she would watch him breathe a lot of nights. Did you have those moments, Annie, where you were overwhelmed and worried and hyper focused?
Yeah, and I was worried even before, with his different symptoms. But then when he got home, I remember the first night you're like, okay, I'm gonna try to sleep in bed tonight and see how this goes. But it was like I didn't want to move because I was afraid, oh, I don't. He's got stitches in his leg. He's got stitches in his chest. He's got drain balls hanging off of here. It was like we learned a lot, and thankfully, my mom is a retired nurse, so she was a big help once again. Not only the caretaker, but also to have that knowledge was a big help.
Talk about lifestyle change. So we're done. We finished our surgery. We're finally feeling better. Are you eating bacon cheeseburgers every day? Do you listen and things change? Talk about the before lifestyle turned into maybe the after lifestyle.
Well, I was a typical, patient or not so good of a patient going into this, right? I mean, I ate anything and everything in as much quantity as I wanted to before the surgery. Coming out of the surgery, I ate completely different. And, no potato chips, no salt, a lot more, fish and chicken and that, and not as many burgers and steaks and red meat and that kind of thing. So, it was, it was harder, I guess, to manage the eating part because I never really thought about it before that. Um, but I have now drifted a little bit further back into some of the bad habits of eating that I had before. But in the most part, I eat very healthy. Annie's vegetarian, and she eats really well, and I join her and try to stay on top of my eating habits. And
Did you back then, did you have coaching? I know we're good at the rehab part. Come on into rehab. Let's walk on the treadmill. Let me watch you walk. Let me coach you how to walk and what to look out for. Was there anyone there back then to say, hey, don't eat the French fries, eat the kale salad, right? Did you get that kind of coaching or you were on your own with some of that stuff?
no, in the cardiac rehab in Clifton, there was a part of that recovery process where they would talk to you about eating habits. And I can remember there was a big pizza. It was a poster of a big pizza, and it was on the wall there. And they said, worst thing that you can eat coming out of a cardiac problem is the pizza. But yeah, they did some coaching, and Annie did some coaching as well, and her mom, would try to keep me on the straight and narrow.
How long until you're back to you? Is it a week? Is it a month? Is it 6 months, right? When do you go for that couple 2 or 3 mile run again, right? When do you back to the guy that you were?
I'm gonna say it was probably 6 weeks
Oh, easy.
before
Not
before
fully,
you
right.
started to, feel like you could go back to doing some of the things that you did before. Obviously, the running, it started off in a walk, and then it was, you know maybe a little bit of walking and then a little bit of jogging. And then it turned into a full jog. And so it was, it probably took a good, I'd say a good 3 to 6 months before I really felt confident that I could do some of those things and not re-injure myself.
when you first came home, I remember you had on the compression socks, remember?
They were handsome.
Yeah.
Sexy Bernie.
Yeah, sexy Bernie.
And you couldn't even walk down the driveway without getting winded.
Yeah.
I remember one of the kids were like, Mom, look at Dad. He looks so old. Remember? It aged, you know,
And I
did
was
a
young.
little bit there, yeah.
Until you start to bounce back again, right? Talk about the family history piece, right? There's a lot of family history with this stuff.
Yeah, mine actually started on my mother's side of the family. Just so happens my mother's maiden name was Hart. And she had brothers. All of them died of heart disease. And then in my own family, um, my brother. So again, there were six of us. I was the youngest. The third brother in the progression in my family, in his mid 40s, had a major coronary, and then subsequently died at 61 of a heart attack as well. So yeah, we had some significant heart history.
Do you talk to your kids about that stuff? Hey, kids, pay attention. Hey, kids, eat well. Hey, kids, make sure you exercise. What's the message that you give to those young kids growing up?
We've coached them their whole lives about eating healthy and exercising and being smart about, not overdoing it with, food or alcohol or drugs or any of that kind of stuff. I mean, um, we've been diligent about being open with them, and all during the process of my recovery, and as time went on, there's always been discussions of our heart issues in the past, and how to protect themselves from finding themselves in the same position that I was in. And some of that stuff you can try to work on so that it doesn't happen, and sometimes it's out of your hands.
Hannah is already established with a cardiologist, and we're going to get the boys too.
With you, Annie, was your healthy eating and your vegetarian stuff before all this? Does it come along with it? Where did that part of your life come from?
Yeah, excuse me. I've been a
me.
vegetarian about almost 30 years now, I think. So, but I mean, Bern eats meat. The kids do too. I'd actually, because I read a book, Diet for a New America, and it just changed my whole outlook on how animals are processed. And
How does this event impact your relationship? Right, you're newlyweds and then young parents, and I know when you're young parents and you're working like crazy, and now my guy's got his chest cut open. How emotionally does that affect you two as you're going through this together?
Annie and I have had a strong relationship for a lot of years, a lot more years than just the years we were married. We dated for 10 years or so, I think it was, right before we got married. But so we had a pretty tight bond going into this thing, which, was very helpful in every aspect of it. So there wasn't a tremendous amount of change in our bond after the surgery. I don't think. I think I'm very thankful of the strength of our relationship before, during, and after the events of my heart surgery.
Same thoughts, Annie?
yeah, same thoughts. Yeah.
And what about your faith as you go through this process? You know, there's such a struggle emotionally, physically, anxiety-wise with the kids. Does faith help you guys through some of these bumps as you're going through it all?
No doubt about it. Yeah, it was, you lean on your friends, you lean on your family, and for us, we leaned on our faith as well, which helped get us through all these bumps in the road.
Looking back, if there's another couple that's about to embark on this journey, and whether it's a woman who has breast cancer or a heart attack, or what's the advice for them about supporting one another through this kind of thing?
Be strong,
Stay positive,
stay positive.
one step at a time. There are a lot of unknowns. There were a lot of things that, right, surprised us, surprised me anyways, especially like with the recovery, because like you say, they send you off, okay, come back for your appointment, but there were a lot of things, that we didn't know. Maybe that's good though,
Sure.
right? You learn them
Yeah.
together and figure out how to get through it, the healing process and all, but stay positive, because if you let yourself get down or let it beat you up, right, it could.
It absolutely can. And Bernie is a guy who, I don't know, most guys minimalize what we're feeling. I got jaw pain. I'm just going to run a little bit more. What advice do you give to that 40 or 50-year-old guy out there that's out on a run or at the gym? What's the advice there, given your experience?
Listen to your body for sure, and be a good advocate for yourself, because we've talked about how Annie felt about this going into surgery and needing surgery and all that kind of stuff. I don't think she has totally explained. She wasn't very happy, that there wasn't action taken before before it was. Maybe me knowing my body and knowing what's going on, along with my doctor at the time, should have been a little bit more aggressive, because it wasn't too I wasn't too far off from not being able to go in for the surgery.
It I think as patients, when we go through testing, we assume, oh, we tested your heart, you're okay. None of these tests are really 100%, right? There are going to be false positive tests, and there are also going to be false negative tests. And so sometimes a stress test might only be 80 or 85% accurate when we go through them. In your experience, where all of the arteries were a little bit blocked, is a common one where the test looks a little bit normal, or more normal than we'd expect given your symptoms. And your doctor did a nice job pushing, or maybe it was Annie did a nice job pushing the doctor. And I think in my experience, that's really important. When we feel something isn't right, it's your job, as you said, to kind of advocate for yourself. And sometimes it drives you crazy as a physician, because you're going, oh my God, no, we've talked about this, we've done every test. Let's do one more test, right? Let's have that open, honest, and conversation, and continue to look.
Yeah.
And it can be hard on both parties, right? The anxiety on your part as a patient, and the frustration on our part when we think we're doing everything right and someone just feels something's wrong. And I think for me, it's all about the communication piece. You got to be honest about what you're talking with one another.
No doubt. I think you're 100% right, Phil. You've got to keep an open dialogue, and you've got to be as honest and upfront as you can be, to make sure you're covering all the bases. You don't want to look back and say, I wish I would have done.
Looking back, what was the scariest moment of it all?
For you, I would think when you woke up.
Yeah.
You were.
There's two of them.
Yeah.
Two areas for me. as soon as we got out of the cardiac catheterization and they said, you're not going home, you need to have a quadruple bypass, that rocked me. And then when I was coming out of that anesthesia after the surgery, that was terrifying.
What about for you, Annie? As you're looking at your wingman, what were the scariest moments for you?
Yeah, when the doctor came in and said your husband needs a quadruple bypass. Yep,
Scary, right?
yep.
Um, any other advice that you might want to give to people out there that are going through an event like this? As a couple it's behind you, right? And you guys, you have wonderful kids, you've had a career, you've retired, life went on. So this super scary moment, life still went on.
Mm-hmm.
And you guys have done really well. What's the advice to help people get through?
Stay together. I mean, do things together for a lot of good reasons. It'll help you emotionally. It'll help you physically. Keep the faith. Keep the faith.
Stay positive. Stay positive.
Yeah.
I think through all these bumps that we have, there's got to be that faith that it's going to be okay. And for me, the most important thing always, and whether it's with one another or with your team, you got to be able to communicate. You have to be able to talk and have those open and honest conversations, and share your anxiety so that you can move. If you're still anxious about something, you can get more answers, which it sounds like is what you had to do with the team at that point.
And we had some friends that live just a couple of doors up from us. And in our discussions, he went through the same surgery with the same doctor that I did. And we had long talks before he went in for surgery. And, he asked the same thing, what advice do you have? The only advice is, be positive. Things are going to be okay. You just need to keep the faith, and you need to keep your support team, whether it's your wife or your children or your partner or whoever it is, keep them abreast of what's going on, keep them abreast of what you're feeling and what you're thinking, and work together with your group.
And I think that as Annie described, you trying to walk to the end of the driveway, there's a moment when that's impossible. And you kind of have to just take that first step and then the second and keep moving through and lean on the team around you when you need help. And it's easier said than done for some people. And I feel bad for the people who don't have that support network that go through this kind of stuff.
Yeah, I agree.
It can be really complicated and challenging. Anything we've missed, you guys? Any closing remarks that you would go, oh my gosh, I want someone to know this?
I just want people to understand that you're going to be okay. You're going to get through it. It's going to be painful. If you can avoid, having this kind of surgery, avoid it, but not at the peril of your life. I mean, if it's something that you need to have medically done, go in, be strong, lean on your support group, and you'll be all right.
Pay attention to the symptoms.
Yeah,
Don't be
I love it.
afraid to go to your doctor and tell them what's going on.
I love it. Thank you guys so much for spending time with us.
That's great.
Hopefully in the near future, we'll be talking to a cardiologist to talk about the differences in 2025 compared to 2008. Some of the new testing that's out there. How do we look at this stuff? How do we find this stuff sooner? things are a little different now than it was back then, and it will be interesting to talk about that.
Do we have time for one more question?
Yeah, I got all the answers. Bernard, do you have all the answers? Or maybe Annie does.
So I understand that there are different techniques now for surgery on your heart. Has medicine come far enough where you're doing it arthroscopically or?
So, to my knowledge, not yet with bypass. But the biggest change for me from a cardiovascular perspective is when we had aneurysms, you know, we used to cut you wide open like they cut you wide open to repair this aneurysm. And you were in the hospital for days and days. And now they are going up and repairing that like a stent, right? And there's a little contraption that they put in there, and you're home later that day or early the next. And so they are getting better with these techniques all the time. Our imaging now, in your day, our CAT scans probably weren't good enough to see some of the things that were wrong. And now a cardiac CT might be able to see a lot of this stuff before, right? And so things are getting better and better and better.
Yeah, if they could get past this, taking the saw and cutting your chest bone open, that would be a step in the right direction.
I don't know if we're there yet, but the hope is that we get better at things and we detect them sooner enough so that we fix your kids, that next generation,
Right.
before it gets to that point where we find it sooner. And maybe there's a medicine to help the plaque not build up as much in certain areas and help encourage you to make lifestyle changes before we get there.
Got it.
That would be to me the ideal part. The hard part is no one wants to listen to that, right? No one wants to say, okay, I got to run and eat fish every day. I don't want to do that. Cheeseburgers and pizza are better. And so it's complicated from a primary care perspective. Annie, anything else from your
You know, and one thing I was thinking too, you know, thankfully we had, you know, insurance too. I mean, Bern was working at AT&T, and I was working at BOCES, and we were under his insurance, and thankfully we had it. I mean, I don't know what people would do without it.
And I don't know if it still is, but it's health expense is kind of the number one cause of bankruptcy for a lot of people.
Sure.
You have an event and then you can't go back to work afterwards, and now the bills just keep piling up. It can be hard. Yeah. It's for me, there are so many financial, emotional, physical. There's so many complicated parts as we go through medicine and the events that we all have. And how do you balance all that with a team to get the best outcome for everybody? Changes with every family, right? Yeah. It's interesting. I love doing it. I love trying to help. I love trying to figure it out. It's different, and it's constantly evolving. Annie, before we close, Paul, can you zoom in on Annie's shoes? Best shoes I've ever seen. Here comes the zoom, baby. Oh, that's what we're talking about. Smith family, thank you so much for hanging out with us tonight.
You're welcome. Thank you for having us,
Oh, my
Dr.
pleasure.